Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
Doing quite well.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone U.S. COVID statistic through today, August 8th. We invite you to submit any questions or comments you have down below or at any of our social media linked in the description. Starting with that COVID statistic, average COVID deaths per day in the last reported week were 24. The same week in 2024, we saw 76. Your reactions to those numbers, Dr. Murphy, and the state of COVID in the US?
Well, no big change for this metric, which occurs after infections start going up, because you get infected, you get sick enough to go in the hospital, you get sick enough to go in the ICU, and some people don't make it out. So that takes a long time. So that metric is standard, but the cases are going up. They're going up really across the United States. And the question is, how high are they going up? The wastewater surveillance, they check this at multiple places around the United States, remains for the most part low, but in the West and South, bumped up to moderate. So we are seeing more cases. And if you look at different health departments that still do report it, emergency room visits and so forth, we're starting to see that bump. The question is, how big is that bump going to be? How big is the summer wave? August is the time that it happens.
Mm-hmm. And as we're looking forward and preparing for these waves, there was a big announcement regarding another pull of funding for certain vaccine development. Can you fill us in?
Yeah, so the Department of Health and Human Services pulled the funding on 22 ongoing projects that are developing mRNA vaccines for respiratory illnesses like COVID and flu, avian flu, and seasonal flu, totaling $500 million. So they're just targeting the mRNA technology. So the mRNA technology is really what totally saved millions of people in the COVID pandemic. The vaccine got out there quicker than anybody ever imagined. It's relatively easy to make these mRNA vaccines. It's a super technology. It's actually been around for over 20 years. And why they're cutting that is there's no scientific reason why they're doing it. These vaccines are safe. And just to quote Dr. Mike Osterholm from the University of Minnesota, he's an expert in pandemic preparedness, well known in the media here. His quote, "I don't think I've seen a more dangerous decision in public health in my 50 years in the business." To throw away this technology it's just foolish. And it makes really no sense. Why take one of your best tools that can rapidly develop a vaccine for anything, a new pandemic pops up or whatever? This is the technology that can get out there the quickest. From start to finish, it was only a little over 10 months to get the first COVID vaccine. That's just incredible. Nobody thought, Tony Fauci, all these other big experts and everything, they said, oh, it's going to take a year or two, No, 10 months. To just throw that away is just foolish.
Mm-hmm. And some of the worst outcomes that have come from low vaccination, particularly in very vulnerable groups, were just highlighted in a new study in pediatrics. So this most specifically about young children who were very severely sickened by COVID. Can you bring us that data?
Yeah, young kids don't handle these severe respiratory infections very well. RSV, flu, COVID. Those are the ones that can kill you, and children really suffer a lot from these things. Now, the COVID vaccine is approved for children. And if you look at this study, it's almost 2,500 children that were followed, 60% that were hospitalized. 60% had an underlying chronic illness. So that makes sense. They're much more at risk for it. But the big thing about this study was of those hospitalized patients, only 4% were vaccinated. So it shows you that if you don't take the vaccine, you're going to be more at risk for not only COVID, but for getting hospitalized as a child. Of these participants, 25% ended up in an ICU, 6.5% required mechanical ventilation. They got hooked up to a ventilator to help them breathe. And a little less than 1% died, or 150 of these children died in the hospital. So it can be very severe, and you can limit the risk of ending up in the hospital, ending up in the ICU or a ventilator if you just take the vaccine. And this is, it's a risk for kids. It's a risk for everyone.
On the other age spectrum, on the other end of the age spectrum, I should say, with older patients, this time with RSV, there was a really surprising finding linking some cardiovascular events to what is a respiratory illness.
Yeah, so RSV infection affects kids typically under a year, and older people if they have underlying risk, and for heart disease, lung disease, whatever. And this is a study in the journal Clinical Infectious Diseases, very good journal. And they looked at 471 patients. Average age was 67. So this is an elderly group for the most part. This is not the ones, the kids. But the very interesting thing about this analysis was that 1/3 of them, more than 1/3, experienced an independent cardiovascular event. When I say cardiovascular event, what does that mean? They went into congestive heart failure. They had developed atrial fibrillation, that dangerous arrhythmia, or they had a heart attack. So those three things were the most common events, and 1/3 of those patients followed after their RSV infection. So it's just another reason why you don't want to get RSV as you get older. There's a vaccine available. Only one dose is required, and it's available. So if you're older, and especially if you have any underlying clinical disease, it's important. But just anybody over it's approved for over 50. But as you get older, that risk just goes higher.
Mhm. Now, the next illness that we certainly don't want to get, but all ages are at risk, is measles and the continued outbreak of measles here in the US. Can you bring us updated case numbers?
Yeah, so the US has confirmed 1,356 cases, 23, increase of 23. This is not going away. The measles outbreak, it's now just like endemic here because we have so many people that, again, not vaccinated for measles. Measles is highly, highly contagious. You can end up in a hospital. You can end up in an ICU, and you can die from it. So far in this epidemic, we've had 3 unvaccinated individuals died early on in the outbreak, 2 kids and one older person with some underlying risk factors. So again, measles in the year 2000, 0 cases. Now, in this one packaged epidemic here, we've got over 1,300 cases. And as soon as that vaccination level drops below 95%, the population is at risk.
Mhm. Now, something entirely avoidable in a different sense are the next round of infections that came from consumption of raw milk. There's been a lot of these cases popping up in the state of Florida. Can you tell us about this outbreak?
Yeah, so unpasteurized milk is associated with all sorts of bad infections. It's associated with Campylobacter, E. coli, Salmonella, Listeria, Brucella, all these things you really don't want to get. You're going to get really sick with these things. And in Florida, it's actually illegal to sell unpasteurized milk, what they call raw milk, to humans. It's illegal. It can be sold for pets, but there's these people that think raw milk is better for you, and they're drinking the pet raw milk. And 21 of them got sick. And it it just is incredible because this is completely avoidable with simple pasteurizations. This has been known for a long time. And if you go around drinking raw milk, this is what's going to happen.
Mhm. And just to be clear, this is not the carton or the gallon of milk you're buying at the grocery store. You have to go to a specialized place, maybe a farm itself, to buy these kinds of products
Right.
for that very reason.
Well, exactly.
Now, more of an anecdotal rise because there's not an official count by organizations like the CDC, but we have seen increased cases of hand, foot, and mouth disease. Can you tell us a little bit about it, how it spreads, and why it's going up,
Yeah,
maybe?
so this is a typical summer infection where it usually starts with a low-grade fever characterized by red, spotty rashes across the hands, feet, and the mouth. And these can develop into small blisters. It can be very painful. There's a lot of drooling because the mouth has these ulcers, and the hands and feet are all impacted. And it's very contagious, and it's just something to be aware of. There is no vaccine here. There's really no treatment. People are just treated symptomatically. But the biggest problem is because of the mouth sores, is kids don't eat or drink enough fluids so they can get dehydrated. So mostly it can be managed at home.
Mhm. So good to know, something to keep your eyes out for.
Right.
Our final story today is going back overseas to Cambodia, where there is another round of avian flu cases in humans. Can you tell us about it?
Yeah, so Cambodia is reporting their 15th case of avian flu, again associated with sick animals. So it does not appear to be a human to human transmission. In this case, it was a 6-year-old girl. And they found nearly 1,000 sick or dead chickens in the girl's village in the past month, including the kids' home, where there were 30 sick or dead chickens. Um, anyway, so it most likely animal exposure, but of these 15 cases, 7 have died. So this is where you're hearing this about 50% mortality to avian flu. It's all coming from the Asian countries. Here in the United States, the dairy farmers that were getting it and the people working with animals, there's still just 1 or 2 deaths that have been reported. So it's something different is going on in Cambodia.
Which is exactly why we're keeping an eye on it and why it's important that those funds were pulled away, something we can be prepared for in the future.
Yeah, the big risk with avian flu, I mean, staying away from sick animals is probably a good idea, is definitely a good idea. The issue is, will this virus mutate and be able to transmit human to human? And that's why all these companies, like Moderna was making an mRNA vaccine for avian flu, why it's so important that we are prepared in case that does start spreading human to human because the mortality rate can be up to 50%.
Mhm. And on that note, Dr. Murphy, I'd like to thank you for your time and your expertise breaking down all the data for us. It's much appreciated.
Well, that's great. Thank you, Katie.
Thank you all for joining us as well. We hope you enjoyed this week's episode of the Ask Dr. Murphy series. If you have any suggested topics, questions, or comments, please leave them down below or at any of our social media linked in the description. Have a great weekend.